Healthcare reform is in flux, but there are ways to get greater healthcare freedom. Here are 3 ideas that should be included in healthcare reform. If healthcare legislation offers tax credits for the purchase of health insurance, then that legislation must define health insurance. Obamacare makes insurance more expensive by defining it as a set of benefits that all policies must cover. Instead, let's define it in a way that gives patients a great deal of freedom. Congress should define health insurance as a minimum amount of coverage, say $100,000 annually. This would make coverage more affordable, and consumers would be free to purchase more coverage and to decide which benefits they wanted covered. We need large health savings accounts. Instead of the requirement under current law that an HSA be coupled with a high-deductible insurance plan, if employers were allowed to offer HSA contributions instead of an insurance plan, people could use the money to pay for any type of health insurance they want, and the plan wouldn't be tied to their employer. So when someone loses their job, they don't have to lose their plan, meaning pre-existing conditions would be less likely to pre-exist, since they'd already have coverage. And with a fixed amount of dollars for health insurance, employees would have an incentive to be more careful when purchasing health insurance and when consuming healthcare resources, driving down costs. To give individuals and families even more freedom, they should have the option of putting their tax credit into a savings account for the purchase of healthcare instead of being forced to buy health insurance. This especially makes sense for people who live in a state like New York, where regulations make insurance prohibitively expensive. First, they would have money set aside for healthcare expenses even though they didn't have health insurance. Second, as more and more people in New York save their tax credits instead of buying insurance, politicians would feel pressure to reduce insurance regulations. Obviously, healthcare reform is much more complicated than 3 ideas, but as a part of comprehensive reform, these 3 changes would make a major difference in helping prevent the problem of pre-existing conditions while keeping healthcare affordable for all Americans. To learn more, read the full article on our website. I'm Matthew Vadum. Thanks for watching.